When it comes to sociology and defining what health is, there are three arguments: social construction, structuralist and objective reality. The first one, social construction, is a term coined by Berger and Luckman, and it's the idea that society moulds what we believe health to be, like health and illness is dependent on what the society has made us think it is. An example of this is how what health is has changed over time. For example, in the past, homosexuality was considered a mental illness, but now it's considered totally normal, which backs up social construction because it shows that society is implementing upon us what it means to have an illness. Another piece of evidence for this is Lamert's study in 1974, and he says that society labels us as ill, which makes us act ill, and it's the whole idea about kind of health and illness being psychological. For example, when there's a big outbreak of something, like we had that sickness bug a few years ago, people would get told they had it and they'd get the symptoms, not because they necessarily had it, but because they thought they had it. Another piece of evidence is Lang's study, and he says that your family socialises you into being ill. So, for example, if you had a mother with schizophrenia, the children see her actions and think that it's a norm, so they are likely to have schizophrenia, not because they've got something wrong in their head that makes them schizophrenic, but because they're copying what they've seen as normal. Okay, the second argument about health is the biomedical model, or objective reality, and it's the idea that health is set in stone. You are either ill or you're not, and it's to do with biochemicalness and not what society says. It's like it's a fact. Sheeran in 1995 did a study, and he says that we know that this is true because medicine treats illness, so it must be something biological. For example, if a child or an adult has ADHD, you give them Ritalin and it calms them down, and this kind of reaction and the symptoms disappearing shows that health is biomedical because you can treat it with medicine. Another way to back this up is that there's some illnesses, for example cancer, and the biomedical model states you can't deny cancer exists. You can't say you've got cancer because society says you've got cancer. You've either got cancer or you haven't. Lastly, Taylor and Field said that biochemical research is based on fact. So you know what you're going to look for, you find it, like you look at scans, you look at x-rays, you look at tests, you can pinpoint what you're looking for, and you can do research based on that. And it's an argument against social construction because you're saying society can't change what the test results are, you have an illness or you don't. The last argument about health is the structuralist outlook, and that's the idea that health does exist, like health and illness does exist, but it's affected by social elements, so it's kind of an in-between the both of them. An example of this is cultural differences. So you can look at something like girls starting their periods, and some cultures see it as totally normal, and others see it as something that needs medicalising. So it's there, but sometimes society can affect how you view it. Another example is that in some cultures or religions, grief when someone dies is seen as a normal process, and in others, for example ours, you can get prescribed antidepressants. So it's like medicalising something that otherwise might not need medicalising in another culture. Another way of looking at it is things like the differences in statistics. So, for example, a lot of statistics state that more Asians get heart disease than any other ethnicity. This could be because they eat more ghee, which is like a fat used in cooking indigenous to them. So it's kind of showing that there is something that's causing it, but society and their cultural way of living is affecting it as well.